I think John Church is probably well known to many of you in this room, but just for those that don't know a bit about John, I'll just say a little bit while we're getting the PowerPoint up. John was born and raised in Africa, but educated in the UK where he became a doctor. But then he returned to Rwanda in 1959 and spent 4 years there, and then spent a further 10 years in Uganda and Kenya. He then returned to the UK and took a definitive post in orthopedic as an orthopedic surgeon. But since retiring, he has started to develop all his interests and passion, and this led him into, firstly, the development of the maggot therapy in the UK and around the world, and to the creation of the IBS that we're all attending now, and he's a founder member of this organisation. So I'd like to hand you to John, who's going to tell you a little about the cancer detection work.
Thank you very much for those kind words. I'd like to start by thanking our very good friend and colleague Ron Sherman for inviting us here to this conference, and also congratulate you on the success of this meeting. It's been very enjoyable, and a great deal has been achieved already. We are going to do a duo here whereby I introduce you to the background to this subject, the historical background effectively, and then Claire will bring you up to date with what we're currently doing in the UK and what is being perhaps also done elsewhere in the world. We're talking here of cancer detecting dogs rather, and I should have actually, with that earlier slide, let's go back to it, have defined biodiagnosis. Biodiagnosis is the recognition of disease by an intact animal, disease in perhaps another animal or in a human being. And we, in this subject, are primarily interested in the use of sniffer dogs, of dogs that are trained along sniffer dog principles to recognize cancer and other serious diseases. This story starts in 1989 with a very brief letter to The Lancet. And The Lancet is a prestigious medical journal in the UK. And this paper was short. It was an anecdote about a lady who went to a clinic, a dermatological clinic, looking at melanoma, and she had this story of a dog which had been paying a lot of attention to a mole on her leg, and causing her anxiety. The dog's behavior was peculiar, so she went to this clinic, and mercifully the two young doctors who saw her there said, "Hey, funny sort of story, let's have a biopsy," and it was an early malignant melanoma. She had appropriate treatment and was alive and well when we were last contacted, which was some years afterwards. Now, the paper, as you'll see there, it received scant attention. Why? Because it was published on April Fool's Day. At least in the UK, that is considered, if you can do something very smart that's rather offbeat, well, you don't pay any attention. Certainly, there wasn't any attention to speak of in the medical world. Now, the other brief article that I shall discuss in a few slides from now is there at the bottom of this one. It's the second publication in this particular arena, and I was privileged to meet a patient who had a similar story to the one I've just outlined. And we published, you'll see Dr. Williams' name is there. He was the author of the first letter, so we published a second letter in the Lancet on the date you see. Now, the actual training of dogs in this particular arena, sniffer dogs, starts, as far as I would know, with Doan Pikel, a retired canine dog trainer with experience in Vietnam. And he, with Dr. Cognetta, a physician, a dermatologist, decided they should try and train a dog to recognize melanoma. They were using that letter to the Lancet as an anecdote. And they did remarkably well in the sense that they trained this dog over a number of years, and the dog was performing to a high level of excellence. With hindsight, there were a number of things that were, dare we say, minimalist in that study. Why it was one dog to start with, and only one lesion, one specimen rather, of melanoma. However, it was pioneering work. It has a tremendous place in my book for the start of this big-time question of how you train dogs in this particular way. Then a group just to the north of here, San Francisco, trained, as you see there, Xing Ling, a standard poodle, in the Pine Street Clinic in the northern outskirts of San Francisco. And you see that in November 2002, they published the paper you see there, that Claire, who is my co-presenter here in this session, Claire and I had the privilege of coming here to California and going to their institute and seeing something of their work. Now, this is also pioneering because these folk have been, and I think still are, training dogs to recognize cancer on breathalyzed samples. So they will have a conventional police-type breathalyzer, take take the filter out of it, use that for training purposes, and then these dogs are recognizing cancer of the lung to a high level of accuracy. They went on to find that dogs would recognize other cancers, such as the breast and the ovary, and they have published along those lines. We were so impressed with the work that they were doing that we organized, the first time I think ever, a conference, a mini conference in the Hearing Dog Center, which is in the UK. It's the center of training dogs for the hard of hearing, actually only 20 minutes away from where I live. And this young lady has been associated with that institute, with the Hearing Dog Center in the UK for many years. And her story, if you notice from the slide, her story predates the other two stories I've so far mentioned. But it's a very similar story to that first one. Here was a dog, you see that, Trudy, who was indicating on what she considered to be a mole of the leg. She went to the doctor, it was excised, found to be an early malignant melanoma and needed further extensive excision. And she is alive and well today. She is a close friend and colleague. And the remarkable thing is that she was working in an institute, remarkable from my personal point of view, she was 20 minutes away from me in the UK. Then another anecdote, I gave a lecture to a group of students on maggot debridement therapy and chose to talk also about biodetection using dogs. And a young man, they gave me a dinner after the lecture, and I was sitting opposite a young man who told me about his father. And here's his father, who, as you see there from the slide, he had what was thought to be eczema on his leg, and the dog was showing an inordinate amount of interest in this lesion. He goes to the doctor says, let's have a biopsy, and it was an early basal cell carcinoma. He has treatment, he's alive and well. Then another patient is depicted there. There's her picture with her little dog. And this was a different sort of story. Here, she took this little dog in as a puppy with a deformed jaw, and because she fed it and nurtured it for all those years, there was a very strong bond between the two of them. And Then the dog started to indicate on one of her breasts, so much so that it actually caused pain. She went to the doctor. The doctor could not feel anything. And at that moment, it could have been no good, because she might have been told to go away, perhaps come again, and forget the little dog. Not at all. The doctor ordered a mammogram, which then showed a deep-seated carcinoma, early carcinoma of the breast. And that was successfully treated, but the wound, sometime later, did not heal. And the little dog went back to the same behavior. And so she goes back to the doctor. Doctor says, let's wait and see. The little dog said no. The little dog kept on saying, you must have, indicating in such a way as to cause anxiety. She has that bit of skin excised, and there's a recurrence of the cancer in that specimen. And she was alive and well. When I last saw her, I know her well. Now, I've collected now a unique, when I say I, we, between us, have collected a unique collection of anecdotes of the sort that you see there, that I've just described. And the cancers that you see there are, as you see, predominantly the skin. If you put the malignant melanoma along with the skin, let's just highlight, here we are, we have skin, basal cell. So there's 3 more cases there, 10 of the 26 or what are superficial, and you might say, well, that's easy enough for a dog to recognize what's happening on the skin. The numeration, by the way, hasn't come out very happily in this slide, but you can follow it nonetheless, that the breast cancer numbers is 6. So that patient I showed you, we now have another 5 patients with similar stories. So just to quickly keep moving, these anecdotes have a common storyline. There's a strong bond established between the patient and the dog. The dog's behavior changes. There's no particular pattern to that, but the patient always recognizes that there's something wrong, and there's anxiety. The patient goes to the doctor, a biopsy, and it reveals the cancer. And all the patients, it says in that slide 24 is a bit more, as you saw, it's 25. All the patients are alive and well when last contacted. All we can say from this is that the dogs have recognized the disease at a stage when it was treatable, and the treatment has been effective. We can't say, of course, that these folks are going to live for many more years, because cancer itself is such a fearsome disease. But they at least diagnosed early, and the treatment was perfected. Now, having visited the folk here in San Francisco, I was privileged to draw together a team of folks for a training team to do a pilot study to test the question of whether dogs can, in fact, recognize cancer. And there's some members of the team along with some of our dogs. And we used basic techniques which Claire will describe elegantly, shortly. But here you can just see the very simplistic way in which we earlier trained our dogs with a cancer sample in one of those containers. And the dog would then indicate on the sample that was the cancer sample. We would train with one cancer sample and 6 or so controls. Then we did this pilot study, this proof of principle study in 2003, 2004, and published in the British Medical Journal, as you can see there, in September of 2004, and had hoped that they would tuck it in, as it were, to the back of the journal. Not a bit. As you see, there it was, front page of the BMJ, to our delight. And as you'll see there, it wasn't just the article itself, but there are other pieces in the same edition of the journal giving this a very high profile. We were delighted, of course. In fact, we were very surprised as well. But we had tremendous media interest, you can guess, from the result of that publication. So just to summarize what I said so far, cancer recognition by dogs, we need a dedicated dog trainer team using standardized training protocols. We've got to, for the sort of study we've just depicted, we've got to have adequate numbers of dogs for training and subsequent service needs. We have to have clinicians. We have to have doctors who will provide us with their patients. We have to have patients that will agree. We've recruited hundreds of patients into our project so far, and all this is done in the context of the clinical work. Sometimes we have to go to their homes later, but a tremendous amount of goodwill is intrinsic to this sort of study. And then we have to have a number of controls. You've got to have patients that have got everything else, you might say, except cancer, as difficult controls. And there has to be a standardization of the handling of samples. We like to get the samples, urine samples, quickly down into -40 so that there's no biological deterioration of the samples so when they're brought up to room temperature for training and so on. And then we have to have a dedicated research team collecting the data and giving us our statistical background to how much we should do of everything in order for it to be robust. So that's the outline of what is necessary, a complex array of interdisciplinary folk from different backgrounds. And I think perhaps that's one of the reasons why that earlier study by Pickel and Cognetta didn't move forward, because they hadn't got the combination which I've just described here. So again, a summary slide. We're saying that in cancer recognition of dogs, the prerequisites for training are the recognition of a single organ pathology, such as the prostate, discrimination between benign or premalignant conditions and malignant conditions of the same organ, the detection of malignancy of the target organ early, and once trained, such dogs must work to a consistently high level of proficiency. And they must work well in various environments, as you can see, with various varied personnel. And here again, another summary slide. If dogs can be trained to detect early malignant changes more dependably than existing methods, they have a huge potential for rapid, non-invasive screening, which will lead to early diagnosis and save many lives. Now, it may sound really very simple, what I've said to you so far, but it is, of course, exceedingly complex. This is just a diagram which I choose to call a semiogram, which simply means that what is emerging as a result of the cancer and what happens after it has developed within it or around it is a very complex thing. Characterized here by that's the cancer mass itself, if you like, here with the living tumor cancer cells, which are decomposing and therefore giving us another spectrum of metabolites. And then we've got infection, just indicated there with the bacterial flora, living and dead. And the whole mix, these various bits of arrow or emerging from that are simply the quantities, if you like, and the amounts. It's an idea to simply give an idea of the complexity of the material and the odor pattern, the metabolites that might be arising from such material. We have noticed, for instance, in more recent studies, that dogs are more accurate at recognizing early cancer than late. And it may be, for this sort of thing, that in the later pathology, there's a whole spectrum of secondary changes. Now, the five senses we know about, and the sense that we are obviously concerned with with our dogs is the sense of smell. But there are other senses dogs have. Goods did there, the list. The hearing, they can hear 4 times as far as we can. They can touch, sensitive to vibration, earthquakes or what. Their smell is whatever it is. Some give us that sort of figure, certainly far better than ours. They have the nasovomeral organ in the roof of the mouth. So when a dog licks its muzzle and the tongue retreats into the mouth, it actually then sweeps the tongue backwards along the roof of the mouth, and metabolites picked up from the exterior are then sensed by the nasovomeral organ as a secondary olfactory structure. But and here I'm going to be a bit cheeky, here are other senses. Clairvoyance, dogs which know when their owner is coming home. There's written evidence that that phenomenon is true. Perhaps we could enjoy a bit of discussion on that a little later. A sense of direction, dogs know where home is, even though the people may have moved home and the dog finds its way to the new home, for instance. And then, most crazy of all, from my point of view, because I'm a dyed-in-the-wool scientist, you see, is there some sort of aura, some sort of electromagnetic area around a patient with a dent in it, you see, due to the cancer. I'm nearly done with this brief presentation. Now, here's my sort of general philosophy that whatever man does, nature is doing it better, and I'm delighted that you folks, Ron, have chosen to be the better foundation in this context. Nature does things better, as epitomized here by the fact that you've got a contrail there, and look at these geese know exactly where they're going in the pitch dark as much as in the light. And if you look at flight in birds or insects, you've got 1,000 different ways in which they do it successfully, and we think we're clever getting from A to B in a big jet. And then really this is a slide for tomorrow when we will be considering where we go from here in the IBS. So I just throw it up here as a sort of bit of a guideline. Has mankind lost a sense of the environment and the biosphere? And I would suggest we have. How should we best interrelate with the environment? And incidentally, in the picture, there are huge contrasts. Look what we're doing to our environment. But in the middle, there's a little airplane on a different course, and not causing a contrail. Why? Because it's a lower level, you might say. So my final word here is all aspects of biotherapy must progress, but we must look at new species, perhaps especially insects. And with that, I say thank you, go well.